And welcome back.
We have joining with us this morning Dr. Freddy Urroz Lopez, who's a urologist at the Belize Medical Associates. And this morning we're going to have a conversation following World Vasectomy Day. Morning, Doc. It's been a very heated conversation from before it started, so we look forward to hearing from you about, and let's start right at the very beginning. What is a vasectomy?
Good morning. Well, a vasectomy is a contraception method. To start with it, I would like to say that it's safe and it's cheap and it's easily to do, okay? So, well, the vasectomy first started to be done by a doctor that was from the United Kingdom in 1980s, okay? And then he started the trial with dogs, actually, and then we get to start the trials on human. So the good thing of vasectomy is that it's a really quickly procedure. It can be done in 2 techniques basically and in several ways of approach. It can be done by local anesthesia, sedation, regional anesthesia, or general anesthesia. That will depend on the patient's preference, okay? Yeah. And it's a procedure that is done within 15 to 20 minutes most, with a really, really quick recovery and barely painless. Okay?
When you say quick recovery, you mean like how long?
Okay, 3 days of rest, and after that you can go back to work, if it's an office work, and to do heavy weight and stuff like that after a week.
Okay, that's weight and work. How about intimacy?
Okay, that's up to every person.
How long do you have to wait?
You could do it even the same day if you feel to. So it depends on the pain tolerance of each one. So
you know, it's interesting that there is a World Vasectomy Day. Tell me why it is important to have general awareness about this type of surgery.
Okay, it is important because men and women, they both have to be into the contraception methods. It's not something that just relies on the female part. Also on the male part, it's important to get into it. And also it's a procedure that is, we could say it, with less chances of getting complications than the female surgery. Because in the female, they have to go into the abdomen cavity to go to check on the tubes and block them. In the male, it's a small scrotum wound that you might do 1 stitch, or even if you don't want to, you cannot do anything and the wound will close on its own. Yeah. Wow. So it's less risky for men doing the vasectomy.
It's also considered a cost-effective family planning method because tubal ligation, which is tie-off, it's major surgery on a woman.
Like exactly.
It's cutting skin, muscle, everything going in, and it's very invasive, I think is the word surgeons use. Yeah.
Exactly. It's more invasive in females. Also, the recovery is kind of long. Yeah. Because we invade the abdominal cavity and it's kind of painful too. Yeah. And with the men, we just cut 2 layers of skin and that's it. And it's less than 1 centimeter the incision. So which is a good recovery.
You know, I get in trouble for this, but I have to ask this question. And maybe let's start off by asking, how popular is this sort of surgery in Belize? And after you say that, if you know, could you compare us to other countries?
Okay, that's a very important question, the one you asked, because the behavior on vasectomy is different in third world countries like Latin America and the Caribbean countries compared with the first world countries. For example, in the United States, is the most common urological procedure done every year, with 500,000 men doing vasectomies every year. And if you compare that with all kind of countries, it's completely different. Probably something because of the nature of the cultural aspect of it. And I think also probably because men think that their manhood is going to get lost by getting a vasectomy, and that's totally false. So.
But you surely, and this is where I was walking to very thin ice.
Those who feel it know it, right?
But for Belize in particular, you didn't give me necessarily a particular figure, but I would assume it's in the less than 2%.
Yes.
And that was just a educated guess.
Yeah.
But there's a cultural roadblock to it. I mean, there's Dante's levels of hell. And for Belizean males, surely we don't even like medical procedures at all. there's a cultural block and a psychological block to it. And no matter how much you sit and tell me, and I believe you're very credible, that this is safe and the best procedure, that cultural block is almost insurmountable.
Yeah. Well, the thing is, I think it has to be many things that it will take down their manhood. Some other thing might think that they won't be able to produce any semen after all when they have, and get potency problems, and when they're having intercourse, they won't have to be able to ejaculate, and that's completely false. Everything's gonna be the exact same it was before the surgery. It won't change. It won't make you more powerful, and also it won't take it down.
So there's nothing that changes hormonal. I think that's what it is. You know, it's like the very common misconception people have even with neutering dogs. You know, the biology of a man, does it change after a vasectomy? In other words, does he have less testosterone and feel less manly, which seems to be so important, you know?
No, nothing at all, because the testosterone, it's produced by the testicles, and the testicle keeps intact, okay? We just work with the vas deferentia. That's where
it seems to be a missing part of our science class, because I remember learning about the vas deferens, and I know the difference in the biological makeup of a man. You didn't learn that in school, Kev?
I did TD, technical drawing.
Oh, I did sciences. There you go. So here's where the snip takes place.
Exactly. So the vas deferentia goes from the tail of the epididymis all the way to join with the seminal vesicles, and then goes into the prostate to where there comes the seminal plasma.
Yeah.
Okay, so the surgery is a very, very quick procedure. As I said, it could be done with different types of anesthesia approach. And then we do a small incision. There are two ways. We can do one on the midline scrotum incision or one on each side. In my personal preference, I prefer one on each side, because if you do that in the midline, you have the risk of getting twice the same vas deferentia.
Okay.
Okay, so when you go on each side, that risk comes to 0.
Please allow me to move away from the science a little and back to, because these are real thoughts going through some men's head, which is that I know for me as a man, one of the challenges that you have is finality, and it's hard for you to deal with things that this is just the way things are. A man's nature a lot of times is to be able to change and improve. And for a man who in his head is thinking, listen, I might be thinking of family planning at this stage because I am with, for example, a partner in a heterosexual relationship, and so we've already made a decision that we're no longer going to have children. But this relationship might not last beyond this point. Is the procedure reversible?
Yes, it is.
And how easy is it to reverse?
That's the thing. First of all, for a man going on vasectomy, I'll recommend them to be completely sure about getting the procedure, okay? Because as in female, it can be reversed too, but you cannot guarantee the results of the reversing, because you know, when you do the first surgery, you're trying to prevent them making girls get pregnant, then you want it back, so sometimes you cannot have both things, okay? So it can be undone, but it's a procedure that takes longer time, and also special equipment like really tiny sutures. You used to use loops to catch the proper areas where you have to do the stitches and put it back. And also it depends, because you know we are supposed to cut 1 centimeter of the vas deferentia when we do vasectomy. If you cut longer than that, it makes harder to undo the procedure in the future if someone wants to, and requires also bigger incision than the one that is done for vasectomy. So the best advice for a man before going on vasectomy is be sure about it. Yeah.
And I guess that's why you called it, you know, a contraceptive or a part of family planning. So if a couple has decided they're done, you know, we know Belize is a shop shit. And the consideration is between tubal ligation or vasectomy. Tell me what the pros and cons are here. If I am married and I have said, you know what, this is not something we want, we are in agreement. So now it's either I go under the knife or he goes under the knife. What are the pros and cons in each side?
Okay, it's faster on the vasectomy, faster recovery, painless recovery. Okay.
Is it cheaper?
Yes, it is cheaper because if you do it with local anesthesia, you basically use a couple of things. Only the scalpel, if you do it with scalpel, because we also have a no scalpel technique that I would like to talk about too.
No scalpel technique.
Exactly.
Wait. So scalpel cuts. So how do you cut
Yeah,
without
how
the
do you-
scalpel?
Okay, it's called no scalpel technique because you don't use a scalpel, you use a special hemostat that has a sharp tip. So use that to.
Different kind of knife.
Yeah, we could say it. But it's not scalpel.
So it's still non-scalpel.
Yeah.
A knife and the other needle is still a knife.
Oh, okay.
We use the ring clamp. This is the one to hold the vas deferentiae, and this is the sharp hemostat to
Okay.
open the skin.
So
And
this has more control.
yeah.
Interesting. So how much cheaper?
Well,
Because
imagine.
that's a lot where.
Yeah, imagine that a tube could take around 30 to 40 minutes, okay? And it also makes at least spending all day on the hospital area a patient. And with the vasectomies, you go after the vasectomy right away, you can go home.
Yeah.
So the cost is a lot. Also,
And some women have to stay and recover in the hospital.
Yeah,
Because it's such major
exactly,
surgery.
you have to use a lot of gauze, you have to use more medical equipment because you reach in the abdominal cavity. So it's
It's a ballpark. One is maybe 25% cheap, 25% cheaper, 75% cheaper.
could be
Yeah, range.
30% cheaper. The 100 being the tube closure.
Oh, 30% of what it would cost for a
Exactly.
tubal ligation.
Exactly.
Yeah, that is significantly cheaper. And I think for me, when you think of, and it's not a male-female thing, I just think looking at it, if you love your partner, putting her through major surgery, costly surgery, and lots of pain versus doing a very small, minimally invasive surgery that's quick and cheaper. It just means, it means overcoming and asking the very relevant questions that you have, right? That,
Yeah.
there's no change within what your performance is, or that it can be undone, but preferably you're sure in your decision.
And also the going back to work is faster because I said in 3 days with the vasectomy. Let's say you do it on a Friday, by Monday you're back at work. And with the tube sterilization, it's different because you got a big one.
Doc, can you tell me, we know that the world is changing, and I can admit that the younger generation, because they're so much more educated and aware, they see things a lot differently. Do you see that in terms of the demographics of people who are coming in to get vasectomies?
Yes, because usually now patients that are under 30 years old and they already have 2 kids already, they want to do the procedure.
And they don't have the kind of concerns that we're
No.
talking about here.
No, and also because, when with every generation, the thoughts are changing,
Yeah.
and now the girls are pushing more. So.
And the accessibility to information
Exactly.
online to kind of build your own security as well.
Exactly. Now you can
Yeah.
YouTube and you can see
Yeah.
how's the procedure done. and
See what the
everything.
scar looks
Yeah.
like.
You have told us probably two cons to doing it, which is it possibly cannot be reversed with the level of success, and it's far more expensive to reverse. But are there other risks that maybe you can share with us?
Oh, sure. Well,
I don't want to hear about a slam dunk case. We're already doing that with Guatemala. It can't be that perfect.
No, it can
20
be,
years.
it can
Every
be that
medical,
person.
yeah.
Okay, there's 10% risk of infection, 2% of chances of getting a hematoma. That is the amount of blood that gets in where the wound is. And there's between 0.5 to nearly 0 chances of recanalization, okay, which it means recanalization,
Which means?
that the both ends get together. But to prevent that, we do several things to avoid that happening.
You're such an honest doctor, and nearly 0%, but he still mentions it.
Yeah.
That's amazing. Yeah. So, what would you say to people, if they're kind of just weighing the options? What are questions that men need to ask themselves? If they're saying, maybe I'll do it. I need to think about it a lot more, but maybe this is something I'll think about. What are some of the questions you recommend to patients to really be sure about for themselves before they undertake the surgery?
First, if they already feel that they're complete with their family and they don't want more kids, they should go for it. Second is that it's a better option in terms of quality you get for your partner, right? Because you don't expose her to a big procedure. And also the thing is that in a very short time you'll be ready to go have intimate without any contraceptive method, okay? It's also important to know that the procedure is not effective right away, okay? The man has to wait 25 ejaculations or 3 months, whatever happens first, to do a semen analysis control and then see if there's any sperm there.
And is there counseling? It's kind of like when somebody's going through gender changing operations, that there's a whole process where you have to go to counseling to make sure that you're sure. In Belize, is there any support system so that somebody who's considering this, somebody who probably is upset now, you know, let's say for example their wife just died and they said, you know what, in honor of my wife, I'm just no more kids, even if I get married again. But that is a temporary feeling, and so it's something through counseling. They would be able to know exactly where they are in terms of the long term. Is there a support mechanism? So before somebody comes to you and says, Doc, cut that tube, that they've legally or in terms of the medical requirements, sat down with somebody to make sure that this is the right decision for them?
Well, usually you try when a person is passing through a hard time like that, you ask them to wait, to give a little time for themselves to think about it. And then when they feel better and they can think through it more clearly, they can go for it.
Yeah, I know OBs who do that as well with women. They make them think about the decision before. So very interesting. All right. So I feel that we have demystified vasectomies enough. Is there any major misconception that you hear all the time that you just want to take this opportunity to tell people, no, it's not so, or even yes, they're right?
Yeah, the big one concerns on men is that they're gonna lose their potency or they're gonna lose the semen, and that's definitely doesn't happen. Okay, it doesn't happen at all. So you're going to have the same life you were having, completely normal. The only thing is that you won't be able to have more kids.
That's a big only.
And of course, that it doesn't protect you from sexually transmitted diseases.
Exactly.
So versus what you were doing before, maybe using a condom,
Exactly.
You can still get infections,
Exactly.
right? Yeah. Okay. All right. Thank you so much for coming in and telling us all about this type of surgery. We really appreciate it.
Thank you very much for your invitation.
Ticklish topic.
Okay. All right, we're going to go ahead and take our final break, and when we come back, we'll have our wrap up, so stay tuned.